These are the patient's pre and post-op photos taken on the same day of the surgery. There's minimal swelling, no visible bruising, and a noticeable improvement in forehead contour. And most importantly, no visible scar. Hello, I'm Dr. Hyo-Wan Seo, a board-certified plastic surgeon at Lively Plastic Surgery in Seoul. Today, I'd like to talk about something that's more common than you might think, forehead lipomas, and how they can be removed safely without leaving a visible scar. A lipoma is a benign fatty tumor that can form anywhere in the body. It's not cancerous, and in many cases, it doesn't pose any serious health risks even if left untreated. However, when it appears on the face or forehead, it can become an aesthetic concern. Usually it gets bigger and bigger, and more importantly, we cannot confirm it's benign until we remove it and send it for a biopsy. That's why in most cases, surgical removal is recommended, not just for peace of mind, but also to improve appearance. Many patients hesitate to undergo surgery because of scarring, especially when the mass is on the forehead, one of the most visible parts of the face. And that's understandable. Even a small scar in this area can be hard to hide. And some people live with their forehead lipomas for years because of this fear. But here's the good news. We now have a technique that allows us to remove forehead lipomas without leaving a visible scar. It's called endoscopic forehead lipoma removal. And today, I'd like to walk you through a real patient case. This was a male patient in his 40s who visited us with a slowly growing mass in the center of his forehead. On physical examination, the mass felt soft and movable, typical of a lipoma. To better understand its depth, size, and exact location, we performed an ultrasound scan. The ultrasound revealed the lesion located between the muscle and the periosteum. It is the area marked with a red circle. The size was 1.1 centimeter. For reference, the top part is the skin, the bottom part is the forehead bone, and the bright white line you see is the periosteum. The ultrasound findings suggested that the forehead mass was located relatively deep, and since it was in an area where scarring would be highly visible, we performed endoscopic lipoma removal to avoid leaving a scar on the forehead. The surgery was performed. As expected, the lipoma was clearly defined and around 1 centimeter in diameter. Even though we were fairly certain it was a lipoma based on physical examination and imaging study, we always send the removed tissue for histologic examination to confirm the diagnosis. Although we conduct thorough evaluation prior to surgery, the diagnosis made at this stage remains a presumptive one. If we proceed with the referral this way, the pathology result comes back within a week. A definitive diagnosis of lipoma was made, as it is a benign tumor and not cancer, so there is no need for concern. These are the patient's pre and post-op photos taken on the same day of the surgery. There's minimal swelling, no visible bruising, and a noticeable improvement in forehead contour. And most importantly, no visible scar. At this point, you may be curious about how the surgery was done. I'd like to share how endoscopic forehead lipoma removal is performed and what makes this technique especially beneficial. If the mass is located in this region, for example, the traditional method involves making an incision directly over the mass to remove it. While this is the simplest and most straightforward technique, scarring is unavoidable. Scar management can help minimize its appearance, but in most cases, some degree of scarring remains. In contrast, with endoscopic approach, we make 2 small holes within the scalp, just large enough to insert the endoscope and instruments to remove the tumor, completely avoiding any cuts on the forehead skin. That's how we can leave no visible scar on the forehead. The second advantage is that it reduces the risk of nerve or blood vessel injury. The forehead contains many critical nerves and blood vessels. Performing the procedure with an endoscope makes it much easier to avoid damaging these structures, allowing for a safer and more delicate dissection. To someone unfamiliar with the technique, this may sound counterintuitive. If you see the ultrasound imaging, with the traditional direct approach, the surgeon must go through the superficial layers, the skin and muscle, where nerves and blood vessels are densely packed, increasing the risk of injury. However, in the endoscopic method, instead of cutting the skin on the face, we make a small hole on the scalp and remove the lipoma by following the bone and the periosteum, the deeper layer, which is a safe zone free of major nerves and vessels. This makes endoscopic removal not only cosmetically superior, but also safer from a surgical standpoint. Today, we looked at a real-life case of endoscopic forehead lipoma removal and discussed the benefits of this technique. If you've been concerned about a forehead lump but have avoided treatment due to scarring or safety concerns, I hope this video helped answer some of your questions. I'm Dr. Hyo-Wan Seo from Lively Plastic Surgery. Thank you for watching, and please don't hesitate to reach out if you're considering scarless forehead lipoma removal.